Hello everyone and welcome. In this video, we'll be discussing the foundations of the curriculum for health professions educators. We'll continue exploring its foundations, definition, and different factors that influence curricular design. In general, we understand the curriculum as an organized and structured way of delivering what is going to be learned. But at the same time, it also represents an ideological statement expressing values, beliefs, and aspirations. All of this is reflected in the curriculum, and the curriculum accounts for and offers what the students and the community require. There are different types of curriculum designs and models. However, there is no clear evidence that a curriculum should be framed in one way or another. What must be remembered is that the curriculum should always serve the purpose and context for which it has been designed. This is something very important and that we must not forget. The curriculum and curricular design is an area in health professions education in which many battles are fought and in which it's sometimes difficult to reach agreements on what students should learn, how they should learn it, what qualities we want them to develop, when we want them to develop clinical skills and contact with patients, or how long it should take to complete the curriculum, for instance. All these factors come together in such a way that the discussion and curricular work and its design never ends and is always under constant review. Traditionally, the curriculum of a whole program, or that of a course or module, was defined by a select group of experts, and the expression of the curriculum, whether implicitly or explicitly, generally included only the content to be covered and perhaps the time required to study it, and some of the teaching strategies to be used. Today, this is no longer acceptable, and a curriculum is considered complete or satisfactory if it includes everything related to the general framework of the experience that students will go through, the context of learning, content, and quality control of what will be carried out. In this sense, the curriculum must serve as a guide for learners, for the educator, and for curricular managers and developers, without restricting or depriving the educator of their creativity in being able to incorporate innovative activities. Today, it is essential that a curriculum specifies the expected results, whether in the form of learning outcomes or objectives, but these must be explicit, as the curriculum is the basis for planning and developing an assessment and evaluation system. Now specifically, how can we define the curriculum of an entire program? This would correspond to a statement of the purpose, objectives, contents, experiences, results, and processes of an educational program, which should include at least the following two aspects. First, a description of the learning structure, such as the entry requirements, the time, organization of the program, and the assessment system. And secondly, a description of the expected strategies for learning, teaching, feedback, and supervision. A curriculum that meets this will then offer all those involved a clear description of the requirements and expectations. However, this is the basis, and in some cases it may not be enough. It is key then to consider that a curriculum must be contextual. Therefore, it is important to review it with respect to local needs. For example, with respect to the needs of the local healthcare system and those of the community. Now, what standards should be followed when designing the curriculum? And many of the aspects that we will see are applicable to the design of your study programs and syllabus of your courses or modules. And here it is important to emphasize that these standards include much more than the list of contents that the curriculum must cover. They include the fundamental knowledge, skills, and attitudes expected of students at the time of graduation, together with the teaching and assessment system, and how the health and safety of patients will be ensured, and the quality assurance of the program. All these standards can be set by the state, by regulatory bodies of the profession, or by the institution in case there is no definition or guide in this regard. In this way, then, The standards for curriculum design should represent a common guide for all institutions that offer a determined program. We see examples of this in the Standards for Education of Regulatory Councils of the Health Professions in the United Kingdom. Here we can see two documents, the Preparing for Practice of the General Dental Council and the Outcomes for Graduation of the General Medical Council. In both documents, then, these standards are made explicit with the expected learning outcomes. These councils then carry out quality controls, verifying that this is actually delivered. They set the learning outcomes, and then the institutions can vary on the methods by which their students reach them. Now a question for you. What guides the standards of the curricular design of your program or courses? A quick guide to know what general aspects are considered within these standards and what elements the curriculum must address has been prepared by the World Federation of Medical Education. This in a global context where the mission and results of the program must be considered, the educational program itself with all its contents, all the strategies and teaching processes and instances of practice and training, how learning will be assessed, the characteristics and needs of the learners, what learning resources are necessary and will be available, in what context and scenario will it be delivered, what are the characteristics of the teaching staff and how are people selected, how is the study plan organized in terms of governance and management, and how is the curriculum evaluated? Is it having positive or negative results? Is there a change needed? And here comes the last point referring to the plans and strategies to renew or update the curriculum. Let us remember that a curriculum is not made for eternity. It must be continually reviewed and adjusted. As we see then, a curriculum is much more than just the content to cover. So why should we consider these standards and the elements that a curriculum should express? Because by doing so, we may bridge the gap between the curriculum that is on the paper, the curriculum that is actually delivered, and the curriculum that students perceive. Now, all these standards and curricular elements that we have seen, they come from a global vision. And relying on international standards should not leave aside the contextualization of the curriculum. In fact, it can be quite dangerous to transfer a curriculum from one context to another without analyzing its adequacy to the context to which it will be transferred. And I am not referring to the differences in relation to teaching and assessment strategies, but to the healthcare context and system where this curriculum will be developed. And it is something that we must consider when contextualizing our curriculum. It is not a simple copy-paste of another context, as there may be relevant variations. The aspects that we must consider to contextualize the curriculum are mainly 5. First, here in the center, we see the knowledge, skills, and experiences necessary for the practice in the local context, irrespective of the healthcare profession. Then, contributing towards the latter, we have the prioritization of health problems, which can be very different from context to context, even within the same country. Then we have the contextualization of knowledge to our local settings, which will allow not only a better understanding of the context of health and disease, but also in relation to communication and clinical decision-making processes. Then we have the fact of becoming familiar with the different ways of practicing the profession. And according to this, even the classification of diseases, their manifestation, and the treatments will be linked to the context. At this point, it becomes evident that the context heavily influences the curriculum. And finally, we have to make the connection between the academic world and the healthcare systems. Without this point, the contextualization can be compromised quite severely. In this way, then, the central idea is that a curriculum must be contextualized in order to be meaningful. From a more general view, we will now turn to the factors that influence curricular design. In the first place, we have the evolution of curricular models and the different perspectives for their development. In general terms, we have a model based on objectives, where these educational objectives do set the selected material, the contents, the instructional design, and the assessments. Although these objectives are designed as measurable, an unfavorable point of this model is that it favors transmission as a means of learning, which focuses on the activity of the teacher rather than that of the student. On the other hand, the outcome-based model aspires to have the student as the main character and assessment as the central axis. It focuses on the student's activity and what the student achieves. Here, the accountability and efficiency of the curriculum are key. The curriculum is responsible for its graduates achieving the proposed outcomes, and that all outcomes are objective and measurable. This focus is especially appropriate for programs in the health sciences, where transparency and public responsibility are issues that have been gaining strength. If we could criticize this model, it would be that as it is based on outcomes, it focuses on teaching everything to the exam, focusing on the exam, which can lead to less creative learning on the part of the students. A second relevant factor influencing the curriculum are learning theories. There is a close relationship between the evolution or changes in learning theories and curricular models and designs. For instance, it is no coincidence that while objective-based curricular models dominated, behavior-based learning theories also dominated, where the teacher's role in achieving certain behavior of their students prevailed. Now, learning theories are focusing much more on learning itself and not so much on teaching, where the role of the teacher is much more on the facilitation side, with dialogue and interaction between students and the content. There has also been an evolution of curricular elements, where problem-based learning and active learning have gained a lot of popularity. This has also happened with the concept of how adults learn, which has also influenced curricular design. Nowadays, we find a great influence of superficial and deep learning approaches, where deep learning linked to curricular integration seems to be the current desired standard. Finally, a third influential factor is the theory and practice of the discipline itself. In first place, we have integration, which can not only be seen from a curricular design point of view, but also from how students particularly learn in the healthcare disciplines. The integration of basic sciences with clinical sciences and skills, together with an early patient contact, are trends that many faculties are incorporating and leaving aside the phases and sequences in which the contents of the curriculum were traditionally delivered, that were highly compartmentalized. The practice of the discipline and immediate application of what is learned should be favored from early years, more than the acquisition of knowledge, skills, and attitudes to be applied later. This, however, should not ignore the fact that all practice must obey a learning trajectory, in which it is essential to first cover and obtain the foundational knowledge for subsequent effective practice, which does not mean that all knowledge must be acquired prior to practice. A second aspect from the theory and practice of the discipline, which I think is quite self-explanatory, is promoting teamwork and interprofessional learning as necessary for effective professional practice. Healthcare is becoming more complex, therefore, the curriculum must respond to these changes as well. The third point is on professionalism as an influential factor in curriculum design. We should address professionalism from early years, and this cannot be separated from the knowledge and skills to develop professionals responsible for patient care. As we have seen then, there are a series of factors that influence the curriculum, where not necessarily a particular model or certain elements in the curriculum are going to make one curriculum better than other. What is important to consider is the foundations of the curriculum and its context, and all these factors to design a curriculum that is effective and functional for the profession and to the context where it's going to be delivered.